In my opinion, product choice, correct anatomical placement, and safe injection technique is something which ultimately determines what the final result is going to look like. To achieve natural results, I always say less is more. You have to inject in a conservative way, especially when you're working on the cheeks. Always assess your patient in a dynamic way, not just a static way. Let them smile, let them talk. And when you see in the cheeks the maximum point of projection, make sure you don't inject more into that area, because once you inject into that area, that projection is going to be heightened and the face is going to look much more natural. Place your product more laterally and try to balance it out with small aliquots, not big boluses. Also, at the same time, make sure that you're placing the product in the correct anatomical space, because if you place the product very superficially, you can have lumping or bumping and the product might look very uneven and unnatural. When I'm planning cheek augmentation, there are 2 or 3 things that I consider. I always assess the patient dynamically as well as statically, and I always keep in mind the areas of fat deposits which are first ones to go, like the mid-cheek or the lateral part, that I address them, and if there is a little bit of sagging of the nasolabial fold or not. I inject very small aliquots in the mid-cheek groove to improve the lid-cheek junction. Then I try and sort of fill up the lateral part of the zygoma, and my product is always placed very deep on the bone. And I always use 1 shot in the cribriform fossa to efface the or lift or support the nasolabial fold. Product choice wise, I use Belotero Volume, and sometimes I use Belotero Volume and Intense. Intense is a little bit more stiff product, so when I use it in the cribriform fossa or I use it in the mid-cheek groove, it gives me a better elevation and projection. But the lateral part of the zygoma, I need more volumization, I need more elasticity, and I need a product which molds itself. So Belotero Volume is my first choice there.
Sure.
For lip augmentation, I plan according to what the patient's desires are. If they're looking for very natural results and just some hydration, I like to use Belotero Balance. And if they're looking for a little bit of lip contouring with a little bit of lip volume, I like to use Belotero Intense. As lips are very unforgiving and the product is usually placed quite superficially, so these 2 product choices actually give me very nice and seamless results without any lumps or bumps. While doing aesthetic treatments with the lip and keeping your results natural, you have to keep certain considerations in your mind. First off, the right anatomy of the lips. Look at the filter columns, look at the cupid's bow, look at the 3 tubercles in the upper lip and the lip lining. You need to enhance all of these. Volume should be placed maximally in the areas where the natural volume is at in the 3 tubercles. If you fill up the whole upper lip, it's going to look like a sausage. Looking at the lower lip, again, the volume has to be focused on the 2 tubercles, which are just next to the midline, and you can do a little bit of lip lining. If you don't respect the natural volume and the natural areas of volume, you're going to end up creating pillows or sausages which are not going to be attractive. When I'm treating younger patients, I treat just the lips, but when I'm treating older patients, more than 35 years of age, I try to treat the whole perioral complex. I try to work on the nasolabial folds, the marionette lines, as well as the chin. This way you get a more pleasing and natural result. Beauty, in my opinion, lies in balance and harmony. When I'm assessing anybody's face, I look at the upper face, the mid face, and the lower face, as well as I also pay attention to the profile of the patient. Creating a balance between eyes, nose, lips, and different parts of the face creates more attraction for a face. To achieve harmony and balance, you have to use a combination approach where you have to use toxins as well as fillers to do contouring and beautification.